George Vogel standing by downstairs with our doctors. George.
Yeah, I've been beating my head against the wall, but no longer, because I have Dr. Peter Chaw with me here to straighten some things out. And we saw some of that video, arthroscopic surgery, or arthroscopy as you call it. What are the advantages of that? I got to think there's a lot, because it seems to be more and more common.
Oh, arthroscopy is pretty much the mainstay. It's pretty much the only way to go as far as knee and shoulder, elbow, ankle problems, where you can pretty much address all the pathology, all the torn stuff, all the degenerated tissue, and just do it arthroscopically, 2 or 3 little holes.
That means just a little incision then, not the big thing. Because I remember in my day in high school, people would get knee surgery, and they would have a scar halfway up their knee.
Yeah, that was back in the dark ages, right?
You just use hacksaws.
Right. So times have changed. Literally, it's a 5-millimeter incision where you could pretty much treat everything from fixing rotator cuffs to repairing meniscus, reconstructing ACLs, etc.
Is that something that becomes less and less of a scary proposition for a patient now as opposed to the older days?
Yeah, the recovery is just tremendous, how quickly you can get back to your sport or your activities day to day. Usually it's about, if it's a knee, for instance, it's crutches for about a week. If it's a shoulder, you're only in a brace for 2 or 3 weeks.
Now, what is the most common injury you've been treating, say, in the past year?
I'd say meniscal tears are probably the number one injuries, followed by rotator cuff problems.
And meniscal being what common folk like me call cartilage, right?
Yeah, exactly. It's a form of cartilage. It's a shock absorber in your knee.
All right. Doc's got a viewer on hold as well. I'll let you get back to your phone call. Dr. Peter Chaw.